not what you're using both?
Well, in the car, this is gonna be wider. That phone is gonna be like on your beard. And plus, I forgot, for the mic, you can't hook it into this.
For the mic,
Remember the mic, because these don't have the headphone jack no more. I don't have that little adapter thing.
Okay, you wanted to use a mic to hook up to that.
Yeah, because YouTube, these phones sound tinny.
Okay.
Especially if you like doing cardio listening, people be mad.
So we're going with that one?
Yeah, for sure.
You want some of this?
Yeah, I want one.
Yeah, go ahead.
You had it out there. I didn't know whether to go in or not. So, all right, man, where are we headed? What's going on, man?
Let me turn this music down.
All right.
We are heading to Apex, Apex Orthopedics and Rehab. They deal with a lot of athletes. My doctor, Dr. Khadavi, he is, my doctor, Dr. Khadavi, he is the doctor for the local pro soccer team here in town, Sporting KC. So obviously he's used to, working with, soccer, right? I'm sure they had knee injuries left and right. But he's used to getting people back to doing what they do, right? Not just, I've had rehab done before in the past, and it was like, the stuff that I was doing was no different than the 70-year-old dude that just got knee replacements. We're both doing the same kind of rehab, and maybe a part of it should be the same, if that's the protocol, but I don't feel like we should be doing the same kind of stuff. Anyways, he hit me to the stem cell game, and today, well, initially it was just the stem cells injections on Wednesday and the PRP injections. PRP is a plasma, and if you don't know about that, they draw your blood, spin it, pull the white blood cells out, make plasma, inject it back into whatever site that you have issue with, be it tendons, ligaments, or soft tissue. So makes you heal, man, like Wolverine. And the stem cells actually help regenerate cartilage as well. So stem cells is the ultimate way to go. It is a little more pricier though. So if you don't have issues with cartilage, PRP is the next best thing. So, but today he wants me to get this prolotherapy injections to prep me for the stem cells on Wednesday. Today's Friday, so Saturday, Sunday, Monday, Tuesday. 5 days later, I'm getting stem cell injections. But prolotherapy, from what I know, what he says is it's supposed to prime me and get my tendons ready for the injections on Wednesday. So a little, cool because the camera's on, man. I can't front, but I'm a little anxious. That's the word I'm looking for. I'm anxious because I'm not trying to get stuck in my tendons, man. In my tendons, inside the knee, all up inside the knee. Oh, for the stem cell, they have to go into my hip. I was gonna, for the first option, the first doctor, they were gonna fly in umbilical cord for the stem cells, right? To use those stem cells. That sounded cool. But now we're going into my hip, right? Into the bone, inside the bone marrow, to get stem cells. That sounds painful. Anyways, of course, they're gonna do like topical anesthetic, maybe even give me a pill or something when they do all that on Wednesday. But he says, yeah, you're definitely gonna know that he's been inside my, I'm gonna know that he's been inside my knees the next few days after the injections. He says three days to a week, depending on the person. So he prescribed me Percocet. That sounded kind of serious. So I only get Percocet if you have like surgery, get cut open. So we'll see how it goes. But so today is the prolotherapy injections to prep me for the stem cell injections on Wednesday.
I want to point out that AJ's stress eating over here. Starburst. This is the traffic.
Yeah, it's traffic, man. Traffic's pissing me off. Like Kick 9 said, ooh, I'm pieced off the Chiefs loss. about that time. I feel like I'm going in for some serious surgery or something. Am I what? Hell no, I'm not nervous. Get hung up on. What are you doing? Okay. Alright. Well.
Every time I go into the bank, also my bankers are pregnant, and I walked into TV by the market,
They want to talk to you about
and they were
pregnancy
both
stuff?
sitting there. I'm like, what the fuck are you guys here? Because I have one at this branch, one at the other branch.
How you doing? Yeah. What'd you bring with you?
This is my camera guy. I talked to Dr. Khadavi. I think I record some of this.
Oh, very cool.
I think we'll all do it. Even with you on this side of the light.
Let me see. We can look real quick. Let's make sure we know we got it. Oh, you can let it. I want to use it, dog.
Man, he did. Well, I don't know if he used that or if he just like tapped on me the first time to get whatever response that he's looking for. I don't know if he used that. I remember seeing that in the cartoons back in the 80s.
Find your funny bone.
Well, that's in your elbow though, not your knee.
Right.
So, come on, bro.
Check this out.
But yeah, in the cartoons though, maybe whack that spot and the fucking leg go like that. That don't happen in real life.
The keys is key. I can get out what I'm saying. What is wrong with you? Actually, it's fine either way.
You sure?
Yeah, I'm positive.
That's not distracting.
Let me make sure. Yeah, turn it off. Let's go for it. Let's sit back over here again real quick. Make sure. Put it down. That's much better.
I feel like this light isn't as bright as the other one.
Are you gonna take your shirt off?
My shirt gonna be off, man. I'm kidding. My knees you be sticking my knees.
Just saying.
I'm taking my pants off, but I got shorts underneath.
Oh, you scared me.
I'm not taking my shirt off.
Saying for just for views.
Just for view. Nah, bro. Not today, bro. Not today.
Pleasure. Good to meet you, Dr. Khadavi. Let me give you a handshake.
There you go.
Can't step into a room without.
This is Jonathan. He's going to be doing some recording, if that's okay.
Yeah, works, yeah.
And then whatever footage that you need, you can chop it up, do whatever you want. If it works for any kind of marketing for you guys, I'll be doing something for Facebook as well, because I know Facebook for me is more local as far as the marketing aspect of it. I just don't do a lot of it now, so I don't want any more clients here in town. And then Instagram is definitely more like all over the world. But yeah, and then we'll do YouTube as well, so it'll be on social media, and I'll talk about Apex and you quite a bit, if that's okay.
Well, AJ, I appreciate that. You know, you don't have to do anything extra special for me and Apex.
Yeah.
But as long as you're the patient, so anything you're comfortable with, I'm comfortable with.
Yeah. Oh, great. That's awesome. Yeah. I just want to talk about record this journey, talk about the journey, because I know a lot of other people don't understand that this option even exists. Like I don't think, or they just don't know much about it. They think it's bogus. But I've gotten so much good feedback from random people just sharing their story. So I'm like, if there's that many random folks that are willing to share their testimony, it has to be good, right? And then when you make somebody pain free, they are cheerleaders about it, and they're going to just discuss it and talk about it. So
that's the whole goal. The whole goal is getting you 100% without surgery.
Yeah.
That's always the goal. And if I look at a knee and it's not something that we can fix with some sort of stem cell or PRP or regenerative injection, and surgery is the key, we're going to get you there right away. But with the partial tear that you have, the tricky part is it's athletes are a different breed. They have different injuries, and like you said to me last time, the last physician, the orthopedic surgeon you saw, missed it, diagnosed with something else.
Completely, yeah.
And for us that see a lot of the athletes, the people that really use their bodies every day, will see different injuries. And this is something we see a lot. MRI misses this a lot. And so ultrasound will catch that a lot more. And my exam caught it, and then ultrasound showed loud and clear the tear on the left and the inflammation, the tendonitis on the right side. So for those, it's 5 years ago, we didn't know much about stem cell treatment for tendinopathy, tendonitis, and tendon tears like you have. 5 years ago, we didn't. In the last few years, we've learned, and we were throwing things at it that weren't working, and sometimes it would work. And so the last few years, we've done a lot of research, part by me and part by some guys in California, one of my former colleagues at Stanford, and there's another guy in Sacramento who's done some research on this specific tendon, which has helped us figure out when is PRP the right option, when is the stem cell treatment the right option, when is surgery the right option. So that's why we've come to what we're doing today, is because of a lot of that work.
Awesome.
So that's why I'm also making you come in 3 different times.
Okay.
Because today we're doing a very quick injection procedure to get your tendon in sort of actually in an inflammatory state, in a positive inflammatory state. It's not going to be very painful, but I'm actually taking sugar water and putting sugar water in your tendon tear.
That's prolotherapy.
Prolotherapy.
Wow. My mother-in-law does it, but she does it's somewhat frequently, like every couple of months or something like that. So I wonder, I guess I should just ask her how come she hasn't picked a different method, but she goes and does that somewhat frequently for her knees.
Right. Do you know what she's doing it for? Do you know what's going on in her knees?
I don't know.
I don't know.
I know she was a gymnast when she was younger, but I don't know what her actual issues are. I just know that she's in pain, so she goes and does that, and it helps. But she has to keep going back for it, which makes no sense. Like, I would want to not keep
That's
going
the goal.
back.
That's the goal. Yeah. If I have to do this every 2 months, then we need to talk about a better option.
Right. So all that was awesome information, but the part that stood out for me the most was this is fairly pain-free.
Yeah.
This
part today.
The other one, he didn't tell me when we met, but I talked to the nurse for a little bit a couple days later, and the other one sounds like there's going to be a bit
the next one.
Pain. Yeah.
Yeah. Yes and no. What you can expect is, so Wednesday when you come in, the first 10 minutes is just numbing you. Numb your skin first,
Yeah.
and then you don't feel too much below that. Then I actually numb around that bone.
Okay.
And I have a skeleton model. I can go grab a skeleton model, especially if you guys want it for the camera.
Yeah, that'd be great.
Yeah.
Well, am I also taking something orally for that as well?
Yeah, a lot of times that's another thing I wanted to go over today.
Okay.
And I don't think. Did I give you a script last time of oxycodones?
Yes.
I think I did. I would take 2 of those
on my way here.
30 minutes before.
Okay.
That's all you'll need.
All right.
Yeah.
Cool.
Let me grab a skeleton model.
Okay. That might be a fun video.
What?
With me on the oxycodone pills.
30 minutes before coming here?
Well, I'm sure by the time I'm here, I'll be a little flighty. I'm sure. Yeah. But it's not going to be anything. When I got my wisdom teeth taken out, they put me under, and when I woke up, I was saying, I don't remember any of it, but I was talking crazy, man.
The good thing is you're going to be with somebody that's not going to take advantage of that.
Yeah, you can be saying some dumb stuff.
Oh, you
for sure.
definitely.
For sure. But I don't care what I'm on, man. I'm going to have something. I'm going to have a comeback.
The clapback's going to be real.
Comeback king.
This is the back. That's the front. And you see how that's thick right here? This is full of bone marrow. This whole area in here is full of bone marrow. And so the first thing I'm going to do is numb your skin, get you on your belly, numb your skin. I'm going to go down to that bone and numb your bone Once I've numbed your bone, you don't feel too much. That's the cool part. Once I'm in there, you don't feel anything. I could keep going and going and going, and you wouldn't know it. I'm literally about half the time, it's so pain-free. People don't know I've done it, and I'm done, and they're asking when they're going to start. About 45% of the time, it's a 3 to 4 out of 10 pain.
Okay.
And then about 5% of the time, it's a 5 to 7 out of more moderate pain.
Mm-hmm.
But the trick is numbing it. So when you come Wednesday, first thing I'm gonna do, numb your bone, let it sit for 10 minutes, and then I'll come in and go right through that bone, pop right through that bone with the needle, and pull out bone marrow. I do 4 different spots.
Okay.
And I do that because when I put my needle in, I get a small circle at the tip worth of bone marrow, like the size of my pinky worth of bone marrow. If I keep on pulling bone marrow out, the rest is just blood.
Okay.
And so I pull there, come out a little bit, pull more, come out a little bit, pull more, and then I get a big area like that of bone marrow. I go in another spot and I get a whole another. So essentially, these are tricks that we know to increase the concentration of stem cells that we're going to get out of there. So I do 4 different locations to increase concentration of stem cells. So.
And is there a certain recommendation of how many stem cells for a particular joint, like the knee joint, like nothing less than 15 mil, or when you're dealing with a particular joint like that, or is there a magical number that you don't go under, that you can do for the elbow? Could be a less amount or whatever.
There's actually yes, there is, but maybe more importantly, there's an amount, a number that where we plateau, and where we don't get any more.
Right.
Once we get to a certain number, we don't.
There's no extra.
There's no extra benefit, and so we try to be right in that sweet spot. If I have too many stem cells, no harm done. That's why we do 4 different spots. I'd rather have too many than too few. Most people in the country, even the ones I've taught, still, for whatever reason, do 1 location.
Wow.
Even though every study that's ever been done shows our stem cell counts are higher if we do 4. I would rather err on the side of having too many, and then you plateau, big deal, you know? But if we have too few, then we're not gonna get that benefit.
Right.
But we're gonna do that. After I numb you, we're gonna draw your blood and do the PRP at the same time.
Okay.
I'll put those in at the same time. Then come back 6 weeks later and do it again.
I'm a little crazy.
Something to get excited about. Yeah.
Okay. Okay. All right. That's exciting.
Any other questions before I start poking?
I think that's it, man. I've stalled enough.
Yeah. So what I have here, this is basically sugar water,
Okay.
plus a little bit of ropivacaine, which is a numbing medicine. So won't be too sore.
Okay.
Be a little sore for the next couple days. Won't be horrible for the next couple days.
Okay. Here we go.
Alrighty. Well, let's get you up here. I'm gonna get you on your back. Kelly, do you mind grabbing a pillow from the C6 store here?
Need this?
Don't get too excited. I got shorts underneath, so don't get so excited about that.
Okay, prepared.
It's light.
What was that?
So right up.
Yeah, we get you on your back. Are you in the weightlifting workout business too?
I am.
Didn't know about your body.
I know you can't tell like AJ. His hoodie's a little baggy.
Well, I had heard of you, and then Furman sent me your name and info and everything, and then
Life starts from
yes.
Herman has a message you want me to pass along. I'll show you after this.
What was that?
Furman had a message you want me to pass along. I'll show
I don't
you.
think I want to see it. I've seen his last 8,000 messages he sends me, and they're joke I think came a week ago. I was doing a neck injection in a young girl right here, and halfway through, I just gave out a little oops. And how long before I said I was just joking?
Seems like it's 40 minutes.
No,
not that
Medical
long.
humor there.
10 seconds.
But so he's using ultrasound
Yeah.
to guide the the needle.
That's exactly right. The ultrasound, we can actually see the needle, and I'll show you guys the tear before we start anything here.
What do you need?
I'm going to grab me one more Chlorhex from down there. All right, AJ, I'll warn you before we do anything. Deal?
Deal.
All right, so I've already shown this to AJ, but for the rest of the world, this right here is his tendon tear, that blackish area right there. And this is a piece of calcium that's coming out and jetting and sticking right into his tendon. This white right there. This is his kneecap. This is his tendon, so his head's up here, his feet are down there. That's the top part of his kneecap. This is his tendon. This is a piece of calcium that's jetting into his tendon. As I come over here, there's a little bit of a tear. That darkish blackish area is his tear. And so for AJ, his left quadriceps tendon is more inflamed and has a tear. The right one is just inflamed. And if you didn't have a tear, I would just be doing 2 PRPs without the stem cell. But what we know,
Lucky me.
lucky you, that's exactly right. What we know from the last few years is that these tears this size without PRP, without the stem cell, just doesn't get anywhere. So you're going to see a needle coming right across. I'm just going to go in and out about 4 times. Be pretty quick. All right, 3, 2, 1, here's a poke. So on the screen, you can see his tendon. You can see my needle going right into it. And AJ's tough, very tough,
That's crazy.
but I know he's feeling that.
Yeah, man,
And-
man, it's this camera. This camera helps. I feel it for sure. It's a weird feeling, man.
Describe it if you don't mind.
It's
Is it more of an ache, a throb, a
it's
pressure?
a bit of
Most
a-
people call it a pressure.
It is a pressure, but it feels like when you hit it, it feels kind of a numb sensation as well.
Yeah. Yeah. I say one of those too. So same thing, I'm just doing it in a little bit deeper there. So that white thing right there, that's bone, which is why my needle hit it and then it doesn't go any farther. So I'm gonna be right on top of it here. Go right below it now. I hate to tell you, but I'm almost done with this knee.
Nice.
How was it? Tell me the truth.
It was. I'm lost for words, man. It was. It wasn't as bad as I thought it was gonna be.
Would you say it was more of a pressure or more of a pain?
It's,
Or kind of both?
A bit of both, but
Yeah.
it's more of a weird feeling. It's a really weird.
Are you done with this one?
My knee really feels weird now. It's a strange feeling.
Well, what I'd kind of expect is your knee's going to feel great, fine for the next 10 hours.
Yeah.
And then the number's going to wear off, and it won't be real bad,
Right.
but it'll be, you'll know I was in there.
Yeah. That's a strange feeling.
So yeah, and the same thing I saw a week and a half ago here. This side looks way better. Still some action, but
Yeah.
man.
Yeah, that
Okay,
one was
this
the
will be
one-
quicker.
That one, oh man.
That's it. That's all I brought you in for today.
What's crazy is this one was the one that was causing the most issues initially
Yeah.
a few years ago.
Yeah.
Yeah. My knee definitely feels weird. So it's okay to bend it and everything.
Yep. Do you want us to get you that knee immobilizer brace right now, or do you want to just grab it Wednesday? Doesn't make any difference. You'll have time Wednesday to get it if you just want to get it then.
Okay, yeah, I'll just get it on. Let's do
Yeah.
that. But do I have to go somewhere else to get it, or just here?
We have them here.
Oh, I can wait.
I don't think you're bleeding.
That's okay. Good.
Yeah, that's not at all. Just so the world knows, you know, you had something done to you.
Superman Band-Aid.
Yeah. Yeah, sorry we couldn't get your request in the Superman Band-Aids. Just the regular one.
Thank
Alright,
you.
AJ, that's all I
appreciate
got.
it. Okay.
Thanks for coming in.
See you on Wednesday then.
Yep. So Wednesday, be here probably an hour and a half or so. And I was going to ask, I don't remember if I told you this before. I usually have a couple physicians or students or someone watching.
Okay.
Since a lot of this stuff, we change our techniques every couple months. And so there are two guys from, I think, South Dakota who are coming Wednesday to kind of see how we do
Okay.
things.
Cool.
Do you mind if they're in the room?
I don't care, man. It's okay. It's all good.
Okay.
Cool. Thank you again. I
Yeah.
appreciate it a lot.
My pleasure, AJ. And again, you definitely.
All right.
So it's been a couple minutes after he injected both knees. It feels weird. It feels kind of tight.
Mm-hmm.
Like he said it's okay to move, but I feel like I'm afraid to move, man. Like it feels weird.
Seemed like you didn't want to step up off the thing.
Yeah, I didn't want to because when I bent my knee, I felt like a tightness, and it just feels like there's liquid in there. It just feels weird, but that's that sugar water and whatever anesthetic that's inside the syringe.
Could you see the needle on the screen?
I looked over the first time on the left leg. I didn't look on the right, but the right one's a better one. The ones that just it's healed and has some scar tissue. But that when he stuck me in my right one, that would hurt more. Yeah, man. So if that, I'm not gonna lie, that wasn't a fun experience by any means. It was okay, but it wasn't a fun experience. So I'm like, Wednesday, if I'm gonna be here for an hour and a half or an hour, like I gotta get stuck in my hips and my butt to pull the bone marrow out first, and then they're gonna inject my inside my knees. Like, so now,
you recording that?
yeah, man, you gotta record that. I'm a little nervous about that one, cause this is okay. Like this is.
When I saw the needle go on your leg on the screen, I closed my eyes.
I didn't want to look, but I looked over at the ultrasound. I saw it. I saw the needle come in like this. I'm like, oh, I looked away. Oh, man. Can't wait to get this over with, man. I can't wait. But it's better than surgery. It's better than getting cut open by a doctor. And then, like, maybe it might work, maybe not, right? That sucks. You have to pay money and get cut open, have gnarly scars or whatever, and then it doesn't work. Then that's so with this procedure, there's no risk except for you gotta pay for it. But I'd rather do that first and then get surgery done as the very last option. I don't want to get cut open for nothing, because most people I see get cut open a lot of times, they're not the same afterwards.
Gotcha. Okay, so you driving home now. How do you feel, man?
Yeah, I feel normal right now sitting down. Like when I stood up off the table, it felt really weird. Like I was afraid to stand up because it feels tight, swollen, and like there's liquid in there. It just feels funny.
But so yeah, sitting down, I feel I don't even know he's been in there. But so it's sugar water, essentially, is what he said, right? And on top of that, there's a bit of anesthetic, like some kind of anesthetic agent in there as well. So that's supposed to wear off here in a few hours. And he said I might feel that. I might be sore for a couple of days once that wears away. But he went in there. You saw it on the video. You saw it on ultrasound. That needle was long as shit, and I felt him moving around in there. So, yeah, that's that. Round 1. Round 2 is on Wednesday, and man, 4 spots in my hip. That was news to me, man. That's new. I keep getting new news every time. And it just these injections keep adding up. They keep getting more and more injections. So yeah, once I get past through Wednesday, I'll be good. I think the downtime is a few days of soreness. So he prescribed. I've had a prescription of 30 Percocets. That's a lot. So I don't think I think I should be good after 1 to 2 days. I don't think I'll be popping those pills because I need to function, man. I'm really supposed to get on a plane 24 hours after those injections, so we'll see. If I can't make it, I'm not getting on a plane, but I'll probably use those pain pills for a day afterwards and then try to tough it out.